Imagine trying to tackle something chronic, like hypothyroidism or Hashimoto's, not just with the usual meds, but maybe with light.
Yeah, it does sound a bit like something out of a sci-fi movie, doesn't it?
It really does. But there's actually clinical research, real studies looking into this very idea.
It's fascinating, really, where physics meets biology in a way that challenges how we usually think about treatments.
Absolutely. And look, we really have to give a big thank you here to RedLightTherapy.Rehab. That's RedLightTherapy.Rehab. They brought this whole topic to our attention and shared the source material that kicked off this whole review.
Yeah, it sent us down quite the rabbit hole. The sources they pointed us to, especially those clinical trial abstracts, give a really compelling look at what might be possible.
Right. So our goal here in this deep dive is basically to unpack the science. We want to look at how they think it works and what the actual studies are showing about red light therapy potentially helping with hypothyroidism and Hashimoto's.
And we're sticking close to the article and research papers provided, pulling the insights directly from there.
Exactly. So let's dive in. What is red light therapy, specifically in this context?
Okay, so we're talking about using very specific wavelengths of like red light and near-infrared light. It's not like the heat from an old lamp or, harmful UV rays.
It's targeted light energy.
Precisely. Usually in the range of about 600 up to maybe 1,000 nanometers.
And why the thyroid? What's special about the thyroid gland that makes it a target for this light?
Well, the thyroid gland is just packed with mitochondria.
Ah, the cell's powerhouses.
Exactly. And it turns out that red and near-infrared light, especially at these wavelengths, are known to interact with a really important enzyme inside those mitochondria. It's called cytochrome oxidase.
So you're essentially giving those little energy factories a direct boost, like shining a light right where the energy gets made.
That's a great way to put it.
Mm.
One of the main ideas, one of the mechanisms described in the sources, is that this interaction ramps up mitochondrial activity.
Which means,
More ATP production. Adenosine triphosphate. That's the energy currency cells use for, well, basically everything they do.
including making hormones.
Yes, including synthesizing and secreting thyroid hormones, T3 and T4. So for someone whose thyroid isn't making enough, like in hypothyroidism, the idea is that giving those cells more energy could help increase their hormone output.
Okay, that makes intuitive sense. More energy for the hormone factory. But, a lot of people with thyroid issues, especially Hashimoto's, are dealing with an autoimmune attack. How could light possibly help with that?
Right, and this is where some of the study results get really interesting. The sources we looked at highlight clinical trials showing a significant drop in TPO antibodies, thyroid peroxidase antibodies.
Those are the markers for Hashimoto's, right? They show the immune system is attacking the thyroid.
Exactly. So seeing those go down is a big deal.
So the light isn't just boosting hormone production. It might actually be calming down the attack on the gland itself.
That seems to be the implication suggested by the sources.
That feels huge, like getting closer to a root cause, not just managing symptoms.
Well, the proposed mechanism connects to improving the health of the tissue itself, maybe reducing inflammation, possibly strengthening the thyroid gland's sort of cellular barrier,
Making it less of a target for the immune system.
kind of like reinforcing the walls so the immune cells don't mistakenly see the gland as something to attack.
Mm-hmm.
It might help calm that overactivation.
Okay, so boosting energy and potentially calming the immune response. Are there other ways the sources suggest red light might be working here?
Yes, improved circulation is another key point mentioned. Red light therapy seems to stimulate the release of nitric oxide.
Nitric oxide. That widens blood vessels, right? Vasodilation,
Exactly. It signals the blood vessels to relax and open up.
which means better blood flow to the thyroid.
Precisely. Better blood flow brings in more oxygen, more nutrients, everything the gland needs to function well and heal.
Mhm.
Plus, it helps flush out waste products and inflammatory stuff from the area.
So better supply lines and better waste removal. Makes sense. And was there a fourth piece?
Tissue repair. Remember that enzyme, cytochrome C oxidase? The interaction doesn't just boost ATP. It also seems to trigger cellular signaling pathways involved in healing.
Like kicking off a repair process.
Kind of. The sources mention observations like increased collagen production. And importantly, some studies using ultrasound imaging reported seeing a reduction in fibrotic tissue that's like scar tissue in the thyroid.
And scarring could definitely hinder function, so reducing that would be a benefit.
Absolutely. So if you put it all together, the sources suggest this therapy could potentially boost cellular energy, reduce the autoimmune attack, improve blood flow, and help repair damaged tissue.
Wow, that really is a multi-pronged approach. It sounds like it's aimed at improving the gland's underlying health, not just topping up hormones.
That's the potential. And the hope, of course, is that this leads to the body being able to produce more of its own hormones more effectively.
Which brings us to the clinical studies. What did the actual research highlighted in the source material find? Were the results as promising as these mechanisms sound?
The article focused on three key studies. Let's take the first one, described as a 2023 trial.
Mm,
Participants were already taking selenium, iron, and vitamin D, which are often recommended anyway.
right, common thyroid support nutrients.
Yes. And then they added red light therapy to that existing regimen for one group.
And what happened in the group that got the light therapy?
Well, this study reported that almost 30%, 29% to be exact, of the participants using the red light therapy were actually able to discontinue their thyroid medication.
Wow, nearly a third got off their meds entirely.
That's what was reported. They also saw, on average, a 500-point drop in those TPO antibodies we talked about in the red light group. And their levels of T3, the active hormone, went up.
Okay, stopping meds and a 500-point antibody drop. Anyone managing Hashimoto's knows that antibody number is significant. It really suggests the autoimmune activity quieted down.
It's definitely a compelling finding from that particular trial. Then there was a second study mentioned from 2023. This one involved 38 women, all diagnosed with Hashimoto's. The reference was Barisha Moharami et al. They used red light therapy just twice a week, and only for 3 weeks, so a pretty short duration. They also had nutritional support, vitamin D if needed, and daily selenium.
Only 3 weeks. What could they even see in that short time?
Surprisingly, even in just 3 weeks, they reported positive changes. TSH levels, that's often high when the thyroid is underactive, decreased by an average of 2 points.
That's a decent shift.
And TPO antibodies dropped by 433 points. Again, a really substantial reduction. They also noted improvements in T3 and T4 levels.
Another big antibody drop. And anything else?
Yeah, an interesting side note reported was an average weight loss of 12 pounds in this group over those 3 weeks.
12 pounds in 3 weeks. That's
Mhm.
noticeable. Could that just be from the thyroid kicking back into gear, maybe boosting metabolism?
The sources don't go deep into why the weight loss happened, but it's certainly plausible. Better hormone levels, maybe improved overall metabolic efficiency. It could be linked. It was reported alongside the main thyroid improvements.
Fascinating. Okay, so 2 studies showing some pretty encouraging results. What about the third one? You mentioned it had a strong design.
Yes, the third one highlighted is a placebo-controlled randomized clinical trial. This was Hoefling et al., initially published in 2012, but with a follow-up study in 2018.
Ah, the gold standard comparing it to a placebo. What was the setup?
Participants got 10 sessions of red light therapy spread over 5 weeks.
And the outcomes?
This study found a very significant drop in TPO antibodies in the group that actually received the red light therapy around 600 points on average.
Another big drop. But what about the placebo group? That's the key comparison.
Right, and here's the kicker. The placebo group, the ones who thought they were getting therapy but weren't getting the real light, their antibodies actually increased over the same period.
Wow. Okay, that contrast is stark. One group's antibodies plummet, the others get worse. That really strengthens the case that the light itself is doing something to the autoimmune process.
It's a powerful piece of evidence supporting that potential anti-autoimmune effect. And there's more. This study also found that 48%, almost half of the participants in the real red light therapy group, were able to stop taking their thyroid medication altogether.
Nearly half off medication after just 5 weeks of treatment. That's pretty remarkable for people often told they need lifelong medication.
It is a significant finding. But then there's the question of how long it lasts.
Exactly. Did that 2018 follow-up give any clues?
It did. The follow-up suggested that the benefits needing less or no medication, lower antibodies, lasted for up to about 11 months after that initial 5-week course of treatment.
Okay, so almost a year, but not necessarily permanent.
Right. It implies that while the therapy can be very effective, it might not be a one-and-done cure. The sources suggest that periodic retreatment, maybe like an annual course, might be needed to maintain those results long-term.
So less like a permanent fix, maybe more like a powerful therapeutic approach that needs occasional tune-ups.
That seems to be the implication. But still, maintaining improved function for nearly a year after a relatively short treatment course, that's a major potential improvement compared to daily medication for many people.
Definitely. especially if someone has issues with medication side effects or just wants alternatives. Now, beyond the core thyroid stuff, the sources mentioned other potential benefits too.
Yeah, sort of bonus benefits observed in some clinical studies using red light therapy. Things like increased energy, which likely ties back to that mitochondrial ATP boost we talked about.
Makes sense.
Also, improvements in mood, some cosmetic effects like smoother skin, fewer wrinkles, even reduced hair loss, which can definitely be a thyroid symptom.
That's often a big concern, the hair loss.
And they also noted improved fatigue, specifically in people with fibromyalgia who are using the therapy.
Mm.
So while you might be targeting the thyroid, you could get some nice systemic side effects too.
Okay, lots of potential upsides. What about the downsides? Safety. Any major risks or side effects flagged in the sources?
Generally, it's considered very safe. The most common side effect mentioned is really minor, just some occasional mild skin irritation right where the light was applied.
That seems incredibly low risk compared to a lot of medical treatments.
It does seem to have a very good safety profile. But there are important cautions mentioned. First, because there isn't enough data, it should be avoided if you're pregnant.
Okay.
Also, you should always protect your eyes, close them if the light is anywhere near your face. And this is critical. If you are already taking thyroid medication, you need to be really careful and watch for signs of over-medication.
Over-medication. Because the therapy might start working and your dose becomes too high.
Exactly. If your own thyroid starts producing more hormones naturally because of the therapy, your current medication dose could suddenly be too much.
What would that feel like? What are the signs?
Things like feeling jittery, anxious, having trouble sleeping, insomnia, or maybe noticing heart palpitations.
Right, classic hyperthyroid symptoms.
Yes. So the sources really hammer this point home. If you try this therapy, you absolutely must monitor your thyroid labs regularly. And you have to work closely with your doctor.
Communication with the doctor is key.
Non-negotiable. If your labs improve or you start feeling those over-medicated symptoms, your doctor will likely need to adjust your medication dose downwards. This isn't something to experiment with on your own if you're on medication.
That is crucial advice. Okay, so let's say someone's listened to this, they're interested, they plan to talk to their doctor. What does the actual application look like? What's the recommended protocol from the sources?
It's fairly straightforward for thyroid application. The sources suggest using devices that emit wavelengths, mainly in the 800 to 850 nanometer range, though the broader 600 to 1000 nanometer range is generally seen as therapeutic.
And those wavelengths are chosen because that's what interacts best with the mitochondria deep inside.
That's the idea, based on the research. For how long, they typically suggest 10 to 20 minutes per session.
Applied where? Just on the neck.
Yes, applied to the neck area over the thyroid gland. And the frequency usually recommended, based on successful studies, is about 2 to 3 times per week.
And for how long should someone do that course?
They recommend a course length of about 12 weeks to aim for the kind of results seen in the research.
Okay, 12 weeks. And then for maintenance based on that study follow-up.
The suggestion from the sources is maybe 1 3-month course per year might be enough for maintenance, although they also note that using the light daily for other things like skin health or general energy is usually considered safe.
Got it. Now, devices. The source material brought up an interesting point about price versus specs. What should people look for?
Yeah, the main point about devices was really to look at the technical specs that matter for therapy, based on the studies. That means the right wavelengths hitting that 600, 1000 millimeter range, ideally strong in the 800, 850 millimeter near infrared area.
And the other key spec?
Irradiance. That's basically the power density of the light, how much light energy is actually hitting the skin per unit area.
Why does that matter?
Higher irradiance generally means the light penetrates more effectively, especially for deeper tissues like the thyroid, and you might achieve the desired dose in a shorter treatment time.
So it's not just the color of the light, but how intense it is at those specific beneficial wavelengths.
Exactly. The sources pointed out that you can find devices meeting these criteria, good wavelengths, sufficient irradiance across a pretty wide range of prices.
From handhelds to bigger panels.
Right. And the article specifically mentioned that sometimes the price difference seems more about branding or marketing hype than actual differences in the core technology delivering those effective wavelengths and power.
So someone might pay thousands for a device that has similar core specs to one costing a few hundred.
That was the cautionary note, yes. To look beyond the slick marketing and really compare the crucial specs, wavelengths delivered, and the irradiance levels at those wavelengths.
That's really practical advice. Focus on the science, check the specs, compare the market. Okay, let's try and sum this all up. What are the really big takeaways from this deep dive into red light therapy for thyroid health?
Well, I think the core message emerging from these sources is that red light therapy looked like a genuinely promising option. It's non-invasive, potentially affordable, and offers a drug-free, complementary approach for supporting thyroid health.
Especially for people dealing with Hashimoto's or hypothyroidism.
Yes, it's a fundamentally different way of thinking about it compared to just replacing hormones or using drugs to suppress the immune system.
And the evidence.
While the science is definitely still growing, the early clinical results we discussed, the significant antibody reductions, the improved hormone levels, and especially that percentage of people able to reduce or even stop medication, those are really compelling.
They certainly warrant more research and attention.
Absolutely. And a huge plus is the safety profile, which appears very good, with minimal side effects reported.
But with that one absolutely crucial caveat,
Always, always monitor your thyroid labs and work closely with your doctor, especially if you're on medication, because dosage adjustments under medical supervision are likely necessary if the therapy is effective for you.
it really underscores the need for informed exploration done in partnership with your healthcare provider. This deep dive, prompted by the info from RedLightTherapy.Rehab, has really highlighted a fascinating possibility.
That something as seemingly simple as light could influence a complex chronic condition.
Exactly. That we might be able to use specific wavelengths of light to interact directly with the energy machinery within our cells, like in the thyroid. It really shifts your perspective.
It certainly does.
So maybe a final thought for you listening. If specific light can potentially influence cellular energy and function like this, what other non-drug approaches, maybe based on bioenergetics or optimizing how our cells work, might be out there, just waiting for more rigorous scientific exploration?
How might looking into research like this change how you think about tackling health challenges or just supporting your overall wellness?
Something to definitely ponder. We hope this deep dive has given you a solid starting point for your own research and, of course, for conversations with your doctor.